Our next presenter will be Dr. Marcel Arcand, who is a full professor of family medicine at the Université de Sherbrooke and in charge of the care for the elderly sector. He's also a physician at the Institut Universitaire de Gériatrie de Sherbrooke and a researcher in geriatric palliative care. Dr. Arcand also spent some time with research at the Maimonides Geriatric Center in 2005 and 6 and prepared a booklet as an educational aid for staff during his sabbatical at that time.
Okay, so I reviewed the literature, medical literature, of what it says of its advantages and disadvantages. The advantages of this technique is that it is simple to use, and so it can be done outside the hospital easily. And some people say it's possibly more comfortable than IV, okay? There are some disadvantages in that you cannot give as much fluid as you can give with an intravenous. So that's why I mentioned it's for light to moderate dehydration. Local edema is frequent, but local skin reaction can occur depending of what you put in the serum, but also due to some personal reaction that it's not allergy, but it's just. And in this particular case, they mentioned that the gentleman had a skin disease, which is bullous pemphigoid, which is a disease which causes like big blisters already, you know, an accumulation of liquid under the skin. So I'm not sure it's the hypothermoclysis that caused the oozing, or, you know, it could have been the disease as well. The question was, does glycis prolong life or does it prolong dying? And I think we can say that hydration prolongs life, whatever the method used. So in that sense, glycis here really prolonged life, but the hydration may also prolong the dying process. And there are arguments for and against artificial hydration at the end of life, which I will review with you. I took this on a website that is called uptodate.com. This is really doctors who review the literature and simplify it for guys like me. And what they say is that artificial hydration at the end of life, those people who are for that say that it's useful because dehydration and lack of electrolytes and everything can cause confusion. So if the patient is not well hydrated, he would be more confused, can have restlessness and sort of twitches, neuromuscular irritability. So they think that rehydration will reduce the acute confusion or the more severe confusion that can come about. Also, and in this way, it goes with what Rabbi Walsh said, some people consider that it's the minimum standard of care. You can't go below that, okay? Now, those who are against say that it creates more edema, more pulmonary secretions that can increase coughing, choking, congestion, more gastrointestinal secretions with vomiting, more urine with the need for bedpan and urinal or whatever, and that dehydration is advantageous in that it decreases the level of consciousness and the suffering from pain, because it's like anesthesia. Okay. So you can see that there are two schools of thought. And when you look at some scientific studies, there's not much, but there have been studies where they compare, we're always afraid that, starvation or dehydration causes suffering. But the people in palliative care, what they observed is that the problem is dry mouth and not so much having fluids inside. So there's little correlation between thirst and hydration. And so it's more thirst and dry mouth. So that's what oral care is so important near the end of life. One doctor used hydration in cancer patients to reduce confusion, delirium, and also what we call opioid toxicity, which is the toxicity caused by the fact that if you're not hydrating, the medication like morphine can accumulate and cause twitches and things like that. So he saw an advantage in this. But a researcher in the Netherlands observed, I think it's 175 cases of patients with dementia, pretty similar to the case that was presented, for whom artificial hydration and feeding was withheld, not given. And they observed the person noting any sign of suffering, like agitation, shouting, facial expression that would express pain. And they concluded that withholding of artificial hydration rarely caused significant discomfort. At the same time, they said, but you have to be aware that there are individual differences, so it's really case by case. And finally, there was research, what we call qualitative research. It's more discussion, in-depth discussions with staff. And someone met with nurses who deliver hospice care, in special hospices where they receive mostly cancer patients, but also other patients with other disease. And the nurses there reported that patients frequently achieve a good death without receiving food or hydration. And actually in Sherbrooke, we have what we call Maison Aube Lumière, which is an hospice, and they don't use artificial hydration there. But as it is a choice that was made at one point, but in fact, my main message is more a case-by-case approach that is needed, because sometimes it can be useful. And so what's necessary, you've got to ask yourself, is there a problem due to dehydration? Like, was the patient more confused when he came back from hospital because he was dehydrated? So I think it was worth trying to see if it, because we're talking of a gentleman who 2 months before was able to walk and communicate, and so it's not the progression of dementia, something happened, maybe strokes or I don't know. But dehydration could have been a factor. You've got to look at the risks and benefits of rehydration, and in this case I think the risks may outweigh the benefits because of possibly more pulmonary secretions at the end of life, the oozing through the skin. And my general feeling is that this technique may be good for cancer patients, but I'm not sure it's very helpful in patients with dementia where lucidity is not there, and they cannot, you cannot bring them back. Maybe it's worth a try, but if after 2-3 days they are still very confused and very and they cannot be with us mentally, I think it's not extremely helpful. Okay?